You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says that nobody should be wearing a loose-fitting denture. With us, we have an expert on this topic, periodontist Dr. Humphrey Ho. Dr. Ho, welcome to the program.
Thank you.
Okay, good. Now, lots of questions I have on this particular topic, and you do this a lot. But for people that don't know your center in Georgetown, who's the typical dental implant patient?
Usually we have two types of patients. The first type is they haven't been seen dentist for a while, they have loose teeth, they have bleeding gum, they have pain. They're just too afraid to see dentists because they've been having dental problem all their life, maybe even since they're a teenager. And then the second group of patients is they have dentures. They've been wearing dentures for a long, long time. They didn't know that we actually can help them to get them fixed teeth in a day.
Now you say, if everything works out on the day of the procedure, that they could literally walk in with no teeth and that same day walk out with upper and lower teeth that don't come out.
Yes.
Is that rare that happens, or?
No, it happens almost every day in our office. We usually schedule the patient either the 8 or 10 a.m. After the procedure, they walk out with fixed teeth by 2 p.m.
Is that right? Now and we were talking about this, by the way, because you travel all over the U.S. To learn these implant procedures, like all the time. Is there that much to it? And you say it's changing all the time.
It's changing all the time. Every year, they have new stuff coming out and more advanced technology coming out to help us, help patients to get the teeth faster, more precise, and more accurate.
So no more dentures, do you believe that? We said that at the top of the show. You think that's the future of dentistry?
That is the future of dentistry. Nobody deserves to wear dentures.
But you make dentures at your office.
We do. For some patients that they can afford dental implant, we do make denture for them. However, we always prep them to get fixed teeth down the road. Are
there a lot of people, like in and around Georgetown, that are either wearing a denture or headed to a denture? I mean, is it a big problem?
There's many. Georgetown, Austin probably have little over a million people. I would say 20-25% of people are heading or having denture already.
Like 200,000 people have a denture or headed to a denture.
Yes, they are miserable. They don't know where to go. That's where we come from. We can help them to get teeth.
Okay. Now your center, let's talk a little bit about your center for a moment. I guess how dental implants are typically done is you go to two different places usually. You go to one place where they do the surgery, another place where they put the teeth on top, and then oftentimes somewhere else to get them maintained.
Yes.
At your office, you do it all right there.
Yes.
And you have your own lab.
Yes, we do.
Is that why you're able to do it so quickly?
Yes. Typically, for most dental implant, it's placed by specialists, and then restoration teeth are done by the general dentist. In our office, we have general dentist, my wife, Dr. May Chan, in the practice, and I place the implant. Also, we have all the technology and lab available to make them the teeth as soon as possible.
So if somebody's watching this today with no teeth whatsoever, maybe they're wearing a denture.
Yes.
Right? In 3 days from now, they could have upper and lower teeth that don't come out.
Not 3 days, same day.
Same day. Is that right?
Yes.
Well, they have to go for the first appointment.
Yes, they do have to come in.
And then the second appointment.
Yes, they can have the teeth.
So like in 3 days from now, you could have upper and lower teeth that don't come out.
We do have a couple patients come in and said that we want to do it today.
Really?
Yes.
Okay.
We see them at 10. That patient, since we don't have any record, we have to gather some records beforehand, but we're still able to give them the fixed teeth by 5 p.m.
Is that right? And that's common here and there?
It's very common, yes.
Is that right? Now, how old can you be to get this done? What's the age range of these patients?
There's no age limit. We have patients range from 25 all the way to 90 years old.
90? Is that your oldest patient?
Yes.
And why would a 90-year-old want to do this?
They don't want dentures.
Okay.
They've been wearing dentures for 20, 30 years. And one day they said that, I don't want this anymore. So we're able to do that for her. That patient came in because her son said that, I want to buy you a new set of teeth.
Okay.
And she said that, okay, so he called us and we scheduled the appointment the next day. We basically know her whole story already because she talked on the phone with our receptionist. Okay. That phone call took about half an hour to an hour. After that, we saw her. She said that she showed me the denture. The denture is so ugly because she's been wearing for 20, 30 years. It's been broken down. And we show her what we can do. She make an appointment the same day. 2 days later, she come in. We give her this one of the most beautiful smile as she said she ever had.
The 90-year-old.
The 90 years old. She said that she never had a smile picture with her grandkids. Now she can.
So what now? How soon can they eat when it's done? If
Same
everything's
day.
okay. Okay.
Same day. They can get. We try to tell them to take it easy.
Okay.
Don't use it to crack open beer bottle,
Okay.
or use it to crack open crab or lobster shell. But other than that, most of our patients able to eat anything the same day.
So what does somebody like that like more? Do they like the way it looks, or do they like what they could eat?
I would say half and half. We have a patient that he is a radio and TV show for sports.
Okay.
Originally, he just said, I need to be able to smile on camera. We did upper and lower fixed teeth for him. He is so happy. Well, the first day, actually he cried during the appointment with teeth delivery.
Okay.
Okay. It was happening the same day.
Like they look at
They look in
themselves
the mirror,
they cry.
they start crying. He said that finally he can smile on camera. It's been like 20 years he's able to see his own smile.
Okay.
2 weeks later, when we see him for post-op, he start talking to us and start crying again. Reason why is he hasn't able to eat a hamburger or carrot for last 20 years.
Okay.
It's a life-changing experience for him. And
So
then
he ends up liking the eating
and he's
almost better than the appearance.
Exactly. We do another lady come in. He said that pretty much same the situation as an other patient that she's been wearing denture for 20 years.
Okay.
She just said, I cannot wear this. It's so loose. I've been going to this dentist trying to make it fit for the last 5-10 years. Nobody can make it fit for me.
Okay.
We do the upper. We just did the upper for her. Upper for her. She come back 2 weeks later and start crying again
Okay.
because her husband haven't seen her with teeth for the last 20 years. So it's more, what we're doing is more than one way smile or eating. It's both.
It's bold. And is this one of those things where they say, I should have done this a long time ago?
All the time, especially patients with dentures. They've been wearing the loose denture, ill-fitted denture for 20, 30 years. This is a life-changing experience for them.
Now, we were talking in the green room earlier that the denture wearers, it's tough to get them in because they don't go to the dentist.
There's no need to see a dentist unless something is broken.
Okay.
And most denture, I applaud to my colleague, make a very good denture last 20, 30 years. They don't need to see dentists. It's very difficult to get them in.
Okay, so if there are, let's say, tens of thousands of people within an hour of Georgetown that are either headed to dentures or wearing why aren't they all doing it? What's your take? Okay.
They don't know about what we can do for them. Even though implant commercial is on everywhere, but they didn't know that they can have their teeth. We can fix them in a day. Let me tell you the story about typical denture patient. They've been wearing denture for 20, 30 years. Before that, most of them have problem with teeth. That's why they end up with dentures.
Okay.
So they do not know that implant can change their life. We can help them in so quick. Because back in the day, when the implant first started, it takes 6 months, 9 months, a year, maybe even longer to get everything done.
Now it can be done in like a couple of visits.
2-3 visits, we can get everything done.
I think you told me you're kind of like the low price leader as well, because of your center, you have all the technology there.
Yes, we are about 20 to 50% lower than most people. The reason why is we have our in-house lab. We do everything in-house. We don't refer to anybody. We can do the surgery, we can do the teeth in the same day and in-house in our lab. Another reason why patients do not do this, they think they're too old. For dental implant, There's no age limit on what we can do.
Look, like you said, 90-year-olds are doing this.
Yes.
Some of your colleagues, you say 100-year-olds are doing this.
Probably.
Isn't it more likely to fall out if you're old?
No, it all depends on the bone. Of course, depends on their health. If they're good health, they have good bone, there's no reason why we cannot place implant on them.
But if you're 85, 90 years old, you're usually on about 6 or 8 medications. Can they still do it?
Yes.
I mean, are your patients on a bunch of medications oftentimes?
All the time. Nowadays, anybody that over 50 who isn't on 4 or 5 medications.
Do you ever have to work with their medical doctor
Always,
to get
all
clearance?
the time. Yes.
Okay.
Yes.
And do you ever get medical doctors that are starting to refer you people?
Yes and no. We have patients, a lot of doctors do not know what we do.
Okay.
And they start, when we call them for medical clearance, they say, really? You can go do this in a day? We tell them, yes, we can do this in a day all the time.
Yeah, more and more medical doctors are now coming forward and recommending this because they know that when you have these bleeding gums and bad breath and all this back, and you're a periodontist.
Yes.
You help me understand this, but this bacterial infection causes a lot of problems.
Yes, the bacteria in your mouth do not just stay in your mouth. It go into your blood and go everywhere in your body. Based on research, show that people with bleeding gum infection has higher chance of pancreatic cancer, harder time to control diabetes, and also higher chance of heart attack and strokes.
Because there's inflammation. I guess
Inflammation is everywhere,
there's an immune response when
Yes.
you have a bleeding gum. I guess.
Yes, it is.
So it kind of, do they report more energy? Like when you clear up and give them brand new gums, like clean up the infection, do they report they feel better?
A lot of diabetic patients feel their blood glucose control much easier.
Okay.
They don't need to be on diet as often. And also, we have a lot of patients told us that they used to have sinus problem. They had congestion all the time. Now we remove all the bad teeth and gum around the sinuses. It's clear up.
They feel better.
They feel better. They said they never breathed so clear for the last 10 years.
Isn't it true though? I mean, if you've been wearing a denture like 10 years, you can't do this, you don't have enough bone.
No, Randy, maybe back in the days, but now we have so much special implant available,
Okay.
and special bone grafting technique available. We can give them, it may take a little bit longer, but we can get them teeth, fixed teeth.
But if you're 90 years old, like that 90-year-old,
Yes,
I mean, if a 90-year-old, you're pretty much going to have lost some bone, is that
Yes,
correct? But
she
you were
did.
able to do that still in a few days.
yes, we're doing that in 2 appointments.
2 appointments, and she
Yes.
walks out with upper and lower teeth that don't come out.
Yes, Randy.
Do you have colleagues that are, because I've had dentists that say, I don't think that's possible. I've literally had people say, they go, I think it's an exaggeration.
It's not. If you go to get the latest technology, go to the latest course available, what we have in research, you know that with the special technique, with the special implant that we
Okay.
have nowadays, we can almost do anything. Nothing is impossible.
Okay, good. Now you think about this all day long, right? I mean, your wife, I guess when you guys go home, she's a dentist. Working. Is that what you do? You talk about dentistry? You may even have one of your, I guess, children
don't-
are going to be a dentist?
We don't talk about much dentistry, but she yelled at me all the time because I spend more time online looking for new technique, new stuff than spend on her.
That's funny. So you're always, you're into this. Is it really, so it's getting that better? I mean, that much faster, everything's done?
It's nice and day when implant first started. Just a single implant takes a year to get it done. Now we can immediately load the implant, which means that you can get your single tooth in a day.
Okay.
And also, most of the time, you get in 6 to 8 weeks.
So we're talking about a full arch upper and lower teeth in just 2 appointments
Full arch upper and lower teeth.
that don't come out.
Most of what we do, as I said before, we schedule the patient at 8
Okay.
or 10 a.m. We finish the surgery before noon. And by 2 p.m., they have the teeth.
Okay. What about pain? I mean, it does seem painful.
Most of our patients is sedated during the procedure. So during the procedure, they don't feel anything.
Okay.
After
So they're
the
numbed up
they're
and they
numb
get
up.
IV sedation.
Yes, they do. And then after the procedure, of course, it's a surgical procedure. You get a little bit sore, a little bit discomfort. But when they look at the smile, everything's worth it.
Is that right?
Yes.
And you say they could eat that night?
They
if
can
everything
eat that
works.
night.
Like soft food. I mean, you tell them to
Yeah,
take it easy.
Take it easy. Nothing really hard and strong, but yes, they can eat steak, hamburger, carrot, anything.
At least 500,000 people wearing dentures, upper or lower dentures, in Texas. Big place.
Probably more than that.
Is it, you think most of these people, it's just the fear of the dentist? Like, nobody likes going to the dentist, right? Mm-hmm. You think it's the fear?
It's the fear and it's the lack of knowledge than what we can do.
Okay.
But with the sedation now, what we do in our office, they barely feel anything.
Now, you guys call yourself 3D dental. Mm-hmm. Is that because of the technology?
It's technology. We have the 3D technology that most advanced available today. We have it in our office.
Is that right? And you say you're like only a handful of guys are doing it at your level. Maybe one other person.
Probably less than a handful.
Okay.
Even though more and more of people like us popping out everywhere in the country, but each city.
Like in Georgetown, very few people doing what you're doing.
Georgetown, I don't think anybody doing
Almost
what we
anybody.
do.
And they travel to see you.
Yes, they do. We do. We have patients coming 5-6 hours away to come to see us.
Is it mainly because you do it quickly and plus your prices are less than most?
Yes, with our price and how quickly we can turn over, and we have patients come from Corpus Christi, which is about 5 hours away, come to our office and said that I want teeth. That's the patient I told you about earlier that they want it the same day because they travel far away. So we advise them it's better at least stay a night so any complication we can take care of.
You can see them the next day.
Yes, the next day. But we did do the surgery. We did deliver the teeth by 5 p.m. They did stay the night in the hotel. Next morning, she come in, we look at it, and ask her how she feels. She still barely any pain. So she's happy, even she drive back home herself.
But back to this bone thing, you say that other licensed dentists will tell patients you don't have enough bone to get dental implants, and you're able to do it.
Yes.
So what is it you're doing differently? Why are you able to do it and they can't do it?
We're just following the latest technology, latest implants.
Which you mentioned, right?
Yes, latest special implant that are available. With nowadays, there's nothing would say that impossible.
Okay.
We always try to educate local dentists. If they cannot do it, refer to us. 99% of the time, we can do something for the patient.
Now, do spouses, like husband and wives, do this, or partners do it?
All the time. We have a older gentleman come in. He has bad teeth. He just say, "I want fixed teeth. Can you do it for us in a day?"
He didn't want a denture.
He didn't
That's
want
why
a
they
denture.
go to you.
He didn't want a denture. We did it. We give him a fixed upper and lower teeth. The next day, he bring his wife.
Okay.
And said that my wife been wearing denture for 20 years. Can you fix her? Of course we did. We did same thing. We did upper and lower fixed teeth for her in a day.
Okay. So now what? Now they're both what? Eating?
They're eating, chewing, enjoying their vacation with their fixed teeth. Nothing need to take in and out. They're one of our best patients. They rave about our office all the time.
So, and do they tell their friends? Like denture wearers probably hang around with other denture wearers.
Yes, they tell our friends, they refer our patients, they make comments on our Facebook page.
Okay.
All the time.
So, and we're short on time, but if a patient goes to you and they're one of the two categories, the people that have teeth that are so bad they have to be extracted, but they don't want dentures, and then the other group where they're currently wearing a denture, what are their options when it comes to dental implants?
For the lower, they have several options, of course. We can place 2 implants for them to have a denture slap in and slap off.
So just snap in, snap out, set of teeth.
Yeah.
Okay.
Instead of nothing to hold on to, you do have some support. The problem with that is it rock.
Okay.
The next option would be 4, 5, maybe 6 implants. We can make a bar, but still slap in and slap off. But it's more stable. Just look at the table. A 2-legged table compared to a 4-legged table.
Okay.
With more legs.
So they can eat salads and things like that. But it's still a denture, but it locks in.
It's locked in. You still have to take in and out.
Okay.
That's the most people don't like about it, is the taking in and out every night.
Okay.
For the upper, same week minimum, we usually like to place 4, maybe up to 6 implants, and step in and step out. However, it make a huge difference because most denture wearers do not like the roof of the mouth covered.
Yeah.
They cannot taste their food. They cannot feel their food. They can, with cold drink, hot food, they cannot feel any of them. However, with the implant, we're able to trim the roof of the mouth away on the denture so they can feel
So you could give them an upper set of teeth that again don't
Yes,
come out.
yes, they don't come out. It's
Roof of the mouth's not covered.
Slap in, still slap in, slap out. No roof of the mouth.
Okay.
And however, you still have to take it in and out every night.
Still
That's
a denture.
Yeah, still a denture.
But it snaps in.
It's
Okay.
The legs option is a little bit more expensive. However, it's the best option from my personal point of view.
Okay.
You don't have to take it in and out. It's just like your real teeth.
So you say it's like as little as 4 implants. You could put a full arch of teeth that are permanent.
Yes, we usually place a little bit more than 4, but yes, 4 implant.
Or 4 or 6 implants.
4 to 6 implant. We were able to make something screw into the jaw for them. They would never need to take it out. We can, but they cannot.
They just come in for cleanings like regular people.
Yes, just regular cleaning. They brush their teeth just like.
Well, that
with
seems
the
like
teeth.
what everybody wants, right? Teeth that don't come out.
Yes.
Now, something you do very interesting. I went to your website, and with, and you have to have a little bit of credit because insurance, Medicare, Medicaid doesn't really, even the best insurance doesn't really cover dental implants.
They don't.
But you have programs for $200 a month. You could get a full arch of teeth that don't come in and don't come out.
Yes, we do have.
Is that right?
Yes, we do have a finance program that can help patients with as little as $200 a month.
Is that rare that people are financing it, or they're doing it? Or it's
95% of our patients finance their.
Is that right?
Yes.
Get it done that way. So
If
now
you-
there's no
if
more
you can
excuses.
finance, do you want to come pay that much? No, because you may be able to do the money better elsewhere.
Okay.
But depends on their credit, depends on their income. They can get it as little as $200 a month.
But you could work with them.
We can work with them, definitely.
And so, again, no more dentures.
No more dentures.
And you do it all right there. So does your wife do part of it and you do part of it? Because you work together.
Yes, we work together. Most of the surgical part, I would do it.
Okay.
And we would deliver the temporary or the teeth the same day. However, anything more involved the teeth and more complicated with their bite, my wife do it.
Okay.
She doesn't trust me on those.
She doesn't trust you on those. Does because you say they look real. They don't look like denture teeth. They're
They don't.
custom made.
They custom made.
Elaborate on that.
Every set we custom make for the patient, fit their jaw, fit their bite, and all of them are made with either ceramic or porcelain.
Okay.
So it look like real teeth. Even though you get as close as possible, you will not know it's fake teeth.
I could spot fake teeth walking down the street. I can't.
You cannot.
There's no way.
There's no way.
So the machines you have at your practice, this in-house lab, makes even the porcelains
Yes.
and zirconia. It's
Zirconia.
also okay. So they could pretty much eat anything, or they have to be careful.
Just like teeth, you're not supposed to eat something hard, too hard.
But they can eat nuts,
They can
salads,
yes.
chewy things like meat.
Gum.
Okay.
Most
Really?
Most denture patients never able to taste a piece of gum because the gum will stick the denture together. This, no problem.
Is that right? Do you hear eating stories a lot? Like did they ever call and say, "Doc, are you sure I could eat this or I could eat that"?
All the time they call us right after the procedure, said, I'm going to have a burger. Is it okay to have it? I haven't had a burger for so many years. And or they said that, can I eat a piece of carrot? They're not able to chew on the carrot, that the teeth won't move. Can I do that? Always.
So an
No
apple,
problem.
could you use your front teeth
Front teeth, apple.
and
no
bite into
problem.
an apple? No problem.
No
Corn on the
problem.
cob, it doesn't matter.
It doesn't matter.
Okay. And then everybody's regret is, I should have done this earlier.
Much
That's what you
earlier.
told me.
Yes, they always said that we should have do this the first day.
You say it's life-changing.
Yeah, of course, it's life changing. Let me give you a story.
Okay.
We have a divorced mom. Her ex-husband is very abusive. She has no esteem all her life. After divorce, she come to us. She's very skeptical, and because she was referred from her daughter.
Was she wearing a denture?
Yes, she was wearing denture, lower denture, upper some broken teeth because of the abuse. So referred by the daughter, and the first come in. Are you sure, doctor, you can do this? We show her pictures. We show her what we can do. After 2 months, she finally decided, okay, I'll do this.
I'm going to do this, okay.
With the day that we deliver her teeth, do the surgery, of course, she was crying. She haven't seen teeth in her mouth. She doesn't have taken it out for ages.
Okay.
Not only that, 2 weeks later, she meet her husband now.
Okay.
Before she get married, she come to us and make sure everything looks good.
Okay, that's a good story.
Yes, her self-esteem go through the roof. You know, what we can do for patients, sometimes we don't even believe it.
Okay.
We have to believe in ourselves to help them.
So you say that you meet them one way, then they get their teeth, and they come in for checkups or
Yes.
cleanings, and it's hard to recognize them.
Yes, regularized. As I say, for example, her, she had a very low esteem, very reserved because she got her abusive husband before. Now she's very outgoing,
Good.
very
Good.
upbeat, and go out to parties, go out to cruise all the time.
Good.
It's unbelievable. I enjoy. I want to have her life too because they go to have vacation every week, every month.
Every month. Now, you're a periodontist.
Yes.
But isn't it, I mean, what about if you have bad gums? That's why you lost your teeth in the first place. If you have bad gums, can you get this done?
Yes, of course, because we clean up the gum. We remove all the infections.
Okay.
We don't leave any infection behind. We want our work to last as long as possible. We'll get it all the time. That's what our patient pool based on.
So your typical patient has the bad gums.
Yes, we do. We clean up the gum.
They get nice and healthy again, the gums?
Yeah, of course. We clean up
The
the
bad
gum.
breath goes away?
Bad breath go away. No more bleeding gum. No more pain. We clean out all the infection. Give them light set, healthy teeth.
And then we're out of time. This is good stuff, by the way. Somebody watching this, they're of the two groups. The one group with the bleeding gums, the bad breath, the loose teeth, they feel like they're going to end up in a denture, but they don't want them. And then the other group that are actually denture wearers. Let's say that they've watched and listened to what you had to say today. But let's say they're still skeptical. They're afraid. What do you say to them?
You don't need to be afraid. If you're afraid of dentists, we have for the sedation that are available nowadays, and our staff are very friendly. We try to help you as much as we can.
Okay, you have a free consultation?
We provide free consultation, free CBCT X-ray, and so we can assess your situation. We give you the as detailed information as we can give you.
And it could be like you get teeth the next day,
Yes,
like teeth tomorrow.
teeth tomorrow.
Like they go in tomorrow,
they come in
could have
tomorrow
their
for
tooth.
procedure. They can get their teeth tomorrow.
That's not an exaggeration.
It's not. We do it every day.
Okay, good for you. I want to thank you for coming on the show. Good stuff. And do they get to see you on the consultation or your wife?
Most of the time it's me.
Okay. I want to thank you for coming on the show. Good stuff. Thanks.
Thank you.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.